Greetings, Dr. John Florendo, the Unlimited Wellness Institute. We're talking about the master control system, which consists of your brain, the spinal cord, and the nerves that come off the cord. So this right here, 6 to 8 pounds of energy, stimulates the entire body. And this controls every organ within your system. And the way that the brain works is that it sends messages down the spinal cord and out the nerve endings to tell the body what to do. So it's an adaptation to its environment, controlling how the body functions in regards to messages being sent. Now, if you look at how the spine and the brain work together, the brain is always moving, it's in movement. Your skull is separated by cartilage, which allows the brain and its messages to be sent by improving circulation through tissue, through the cerebral spinal fluid being sent down the entire length of the spinal cord all the way till your tailbone. So when we don't have this movement happening, we have this movement happening, the body's not functioning at 100%. And we need to be able to improve that circulation and cerebral spinal fluid movement throughout the entire length of the spinal cord. And we do that by doing a specific adaptative neurological, what we call adjustment. And we do that by structurally correcting the misalignments along the spine, mainly at the cranium, the skull, and the first two levels of the spine, first C1, second C2 levels. And those are actually helpful for, because that's where the spinal cord's brain stem that turns into the spinal cord begins. At the junctions between the skull, the occipital bone, the first and the second vertebra of the spine. And as you can see, the first and second vertebra of the spine make up the hole where the spinal cord, the brain stem, the beginning of the cord, travels through as it comes off the brain. So if you look at that junction from the side view, that's actually the spacing that we should have, right? In most cases, what happens when people have problems starting is that this space closes. And it may also, what they call, rotate and then choke off the cord, the brainstem itself, right? So what we're looking at is correcting that level, making sure those levels are functioning as close to 100% as possible to be able to send messages down the nervous system and telling the body what to do and what not to do. You know, the body is also protecting you. Not only is it sending messages, the nervous system sending messages to the body, but also the body is sending messages back to the nervous system. It's a 2-lane highway from the environment to the body and from the body to the environment. So correcting the misalignments, what we call subluxations, meaning less light, less lux, light, less energy, light is energy, traveling through the nerves, traveling at 287 miles per hour, traveling to every cell in your body. You imagine every cell, you have 100 billion cells, and every cell has a little nerve ending telling it what to do, telling the body how to function, how to send messages back to the body as well, to tell the environment how the environment is as a feedback mechanism. So remember this very simply. Structure determines function. Structure, your spine, the skull, the brain sending messages down the spinal cord out the nerve endings, telling the system, the nervous system, how to function properly, how to function as close to what we call optimum homeostasis. Homeostasis means just level health, right? When we have homeostasis, we have level health, we have the body functioning as close to 100% as possible. You have to take into consideration too, by the time we get sometimes patients that come in, they've already been through specific procedures and may have had surgical intervention where they may have parts taken out, or they may have had a fusion, or they may have had their gallbladder removed, or whatever, lung removed. So they may not be coming into the office with 100% function of the body because they don't have 100% function. So we're trying to make the body work as close to 100% as possible. And it's also what they call a limitation of matter, meaning that the body parts may not be able to function 100% because of damage prior, right? So we're trying to get to as close to 100% as possible. So remember this also is that when a bone is out of place irritating a nerve, it's going to cause problems, right? That's what we call the subluxation or lesion. And when a bone goes back in place, it relieves the nerves, help the body to work as close to 100% as possible, and we live at homeostasis or level health and prevent what they call dis-ease, lack of harmony, lack of homeostasis is called dis-ease, not disease, but dis-ease. We're trying to prevent dis-ease and have the body work as close to 100% as possible. And that's what happens here at the Unlimited Wellness Institute, where we are looking for the root cause of problems, not treating symptoms, right? Your pain, your headache, your dizziness, your shoulder issue, your movement problems, those are symptoms, not the problem. The problem is what's causing the symptom. And that's what we're looking to do here at the Unlimited Wellness Institute is find the cause of your problems. And everything we do, the examination, the evaluation, the consultations, everything that we run you through in the office is determined to find that cause. So you're in the right place. We welcome you, and if you need more information, please go to drflorendo.com or unlimitedwellnessinstitute.com for more information, as well as some great references for you. Thank you for listening. Dr. Florendo, the Unlimited Wellness Institute, the home for dedication to the improvement of your health. See you soon.